Good morning. Today is Wednesday, May 15th. Today is Fedya's birthday. He's our second son, our second child, and he was born here in Uzhhorod 10 years ago at the maternity hospital. I remember when we were at the maternity hospital when he was born, they said it was like the first time a foreigner had given birth there in like 5 or 6 years or something like that. So interesting. We've actually have been in Ukraine for 12 years. We've been living and working in Uzhhorod, Ukraine, which is in the westernmost part of the country. And I have been doing occupational therapy here for 12 years. Started out as doing like home care, visiting people in their homes and providing treatment sessions. And now we have a clinic. So it operates more as an outpatient clinic where patients come in for their therapy sessions every week. We give our patients 50 to 60-minute sessions, and the majority of our treatment is occupational therapy based. We mostly work with diagnoses of stroke, traumatic brain injury, but today I wanted to show you some of the more unique treatments that we do here at the clinic, because in Ukraine it's very common to find physical therapy or physiotherapy, as they call it. Occupational therapy is getting more popular, and people are understanding more about the uniqueness of occupational therapy, but physical therapy is more common. So one thing we have tried to do is see where the holes are in the existing rehabilitation system. So, and how can we fill in those holes? So physical therapy, they are covered. Actually, just yesterday, I contacted one of my colleagues who's a PT, and I said, hey, I've got a patient who's having some leg and specifically some ankle issues. Can you take a look at him? And I'm confident that he's got it covered. But one of the holes that we have found in the therapy system is speech therapy. So we are incorporating aspects of speech therapy into our occupational therapy treatment sessions. So I know if there's any SLPs watching, you're probably like, no, you're not supposed to do that. But we actually have no choice. There are no speech therapists that are trained in the way that we need in this city. And we're talking about a city of like 150,000 people. There are speech therapists, but they are trained to work with normally developing children, and that's it. So many times after a patient has had a stroke or a traumatic brain injury, their speech is also affected. And one of the most common things that we see are some level of aphasia, where the patient can understand everything that you're saying, but they have difficulty communicating it. They are not able to speak the words. They know what they want to say, but they can't speak it. This is a huge problem, and there is no one in our city treating this. So we have stepped in to provide this type of treatment, aphasia treatment. Now, we are working with speech therapists. I have done a lot of research online. I have found some amazing websites by American SLPs. One is Tactus Therapy. They have an amazing website with so many resources of how to treat aphasia and a lot of evidence-based research. So I use that website quite often to get treatments. And also in Ukraine, we have one speech therapist. She's based in Lviv. And this city is about 3 hours by car, so it's not practical that our patients can go there for treatment. But this speech therapist, she was trained in Ukraine, but then she got a master's in speech therapy, speech language pathology in the US. And she came back to Ukraine with the mission of training as many Ukrainian speech therapists as she could. So she has an amazing program where she has mentored and trained Ukrainian speech therapists. Unfortunately, we still don't have one in Uzhhorod, but I'm very thankful that I can communicate with this colleague in Lviv, and she has referred me to another SLP in Lviv who has been a big help to us. She has been providing us with apps that are in Ukrainian that can help in the speech therapy process. She has also been providing just advice. We send her videos of the patients that have aphasia. She has communicated directly with the family members of these patients. So we are getting mentored by a speech therapist. So I want to show you some of the treatments that we do every day with our patients that have aphasia. Along with that, while we're treating the aphasia aspect of it, we also include some different cognitive aspects, like the patient's visual processing skills, some cognitive things, because very often after a stroke or a TBI, there are visual and cognitive things going on that the family never knew about and never noticed until we start doing these specific treatments. And they're like, oh, I didn't know he had difficulty, with knowing, how to put a puzzle together, with knowing how to match certain things. So I'm going to show you some of the things that we do and talk about how we use them. So we have this really cool card games. We have 3 different versions of them, and it's called Double Image. And what it is you have a set of cards, and any 2 cards that you pick up, they will have a matching image on both of them. And so you can see here that there's a clownfish, an orange and white fish on this and this. So one of the things we do for visual processing is we put 2 cards down. We ask our stroke patients, find the matching picture. And you can see with all of the extra visual stimuli, it can get pretty, it can take you a minute to figure out what the matching picture is. In addition to that, when they find the matching picture, we're also asking our aphasia patients, tell me what that is. Say the word. Find the word. I know that you know the word. Now let's draw it out and speak it. And so this is one of the most popular treatments we do with aphasia, is the patient looking at something and drawing out the word and speaking the word. And the more we do that with them, we actually see so much progress. We also have some cards of different animals. And so we will have our patients look at them. What animal is this? A panda. Where does it live? Usually in China, in the jungle. So we also, on the other side, you can turn it around and it will tell you the name of the animals. So sometimes it helps our patients with aphasia to read it, and then they're able to say it. So these are some of the other things that we do. We also do matching. So I have the word panda and the picture. And so if these are all spread out over the table, I'll have my patients match the word to the picture. One, this helps me confirm that they can read, especially when they're not able to tell me that they can read. Also, some nice visual processing skills that they can match, that they can associate this word with this picture. And also, in the end, I'm asking them to read and to say aloud, or to say just from looking at the picture. We also have a map of Ukraine. One, it's a puzzle, so really great for visual processing skills. And also just for some basic cognitive things of, where is this oblast located compared to that oblast? As they put it together, we're talking about the name of the oblast, the name of the capital of that oblast. What are the cities? There's different pictures on here. What is this? What is this? And having them draw out those names. Another thing that we have is similar to the game Bingo, but this is a transport version, different types of transport. And I like this one because it's not too childish. You know, it's a good thing for adults also. Different modes of transport. So one, we go through it and I ask them to name it. What is that? What is that called? And they have to practice drawing out that name. Now, sometimes I need to tell them the name and they will repeat after me. What I like about this is it gives you a list of everything in Russian and Ukrainian. So you can refer to the list if you don't know the exact name. It also comes with these little cards. So we can also incorporate some really good visual processing stuff, visual cognitive stuff. Find the correct picture to match with the existing picture on the card. You would be surprised how many people have difficulty with this. It seems like a simple exercise, but people with a stroke or a TBI, they're really experiencing other difficulties more than just speech or more than just their arm not working. There's a lot of cognitive issues going on. So this is a great one that we do with our patients also. We also have some simple games like memory. So where you have two sets of matching cards, but you put them face down, and the patient needs to turn them over and find the matching pair. And if they turn over, something that's not correct, they have to put it back. So with one of our patients with aphasia, how we play it is once he finds a matching pair, he needs to speak and tell me, what is this? And I might also ask him some different questions along with an elephant, like, where have you seen an elephant before? What do elephants like to eat? Where do elephants live? And I'm just wanting to get any answer that he can give me, anything that he can pull out in his speech and tell me. So these are just some of the things of how we incorporate speech therapy into our treatment sessions, and also how we incorporate cognitive aspects and visual processing aspects. So when our patients come, they're getting more than just an occupational therapy session. We're also adding in speech therapy, and also when we have Dr. Gabriel working with the patients, he always comes up with just these amazing different things of how to incorporate psychiatry and psychoanalysis into it, different things to get the patient to do more work, or different strategies of how to make it different so that we're encouraging the patient to work harder or to work smarter. So it's really pretty cool of how we're able to incorporate all of these different things into our occupational therapy sessions. So I hope you guys found that interesting today. I'm also going to share a short and also a picture to give you guys a close-up of some of these different treatments that we use, the games, the cards. And if you know any speech language pathologists or speech therapists who would be interested in developing a relationship with us, someone who we can talk to about evidence-based practice, someone who works with patients with aphasia especially, we would love to be connected with them. So if you know anyone, please get us connected with them, share the video with them, and we would love to start a relationship where we're getting even more input from different specialists. So we're going to get ready for our first patient to come in a little bit. I hope you guys have the best day, and thank you again for all of your support, for your encouragement, for your notes. We really understand that we're not alone here, that we have a huge team of people that are behind us, encouraging us, and we're so thankful for you guys. So have a great day. Bye.